The answer is no one has an absolute positive and proven solution. When you have a cold, you take NyQuil. When you have cancer, you undergo chemotherapy. But when you have post-traumatic stress disorder, what is your go-to treatment? Because we have some answers but all incomplete, it is extremely valuable to continue to invest in research for treatments of PTSD. According to the Diagnostic and Statistical Manual of Mental Disorders 4, a person has post-traumatic stress disorder if they experienced a traumatic event, are having intrusive recollections of the event, avoid stimuli associated with the event, and have a numbing of general responsiveness hindered by hyperarousal. And these problems continue for more than 3 months. And they cause impairment in social, occupational, or other important areas of functioning. Do you know that patients of PTSD are not just veterans, but also survivors of physical and sexual assault, abuse, accidents, and natural disasters? If you said no, you are the reason more research needs to be done. Precise factors of diagnosis and knowing effective treatment can lead to a wider dissemination of these facts, and therefore become more common knowledge. When you think you've encountered PTSD, you'll know exactly what to look for. And a medical professional will be 100 times more prepared and thus able to more accurately diagnose PTSD, rather than misreading or coming to a false conclusion, or perhaps even missing the diagnosis completely. What if you were more likely to suffer from PTSD than the person sitting next to you? Would you want to know? There has been limited research in this area, but there is much to be discovered, such as possible predispositions and the impacts of PTSD on specific populations. Predispositions may include things like family history, socioeconomic status, coping patterns, and genetics. And various populations would include those of a specific age, ethnicity, gender, and sexual orientation. Whether you may know someone or you yourself comes to suffer from post-traumatic stress disorder, these factors may be useful to know. Now, some of the most popular and effective treatments currently are cognitive behavior therapy, exposure therapy, group cognitive behavior therapy, and pharmacotherapy options. But which is best? That seems to be the ultimate question, and where much more extensive research is needed, especially because one exclusive treatment may not be the answer. A mixture of therapies and pharmacological options may actually prove to be the most effective. We just need to know what the right concoction is. PTSD patients could also largely benefit from individualized treatment, but we need to learn what specific factors make for what treatments. Other essential topics for research are which ones have the longest lasting effects, and which may just need modification. A returning veteran deserves a stable family life, not hardship. More research into effective treatments may lead to a greater number of patients healing. Express your concerns and desire for funding to your political leaders and government officials, such as U.S. Senator Katie Lee Hutchinson or Texas Representative Sylvester Reyes. Most importantly, educate yourself. Watch videos, read, talk to people. With more knowledge will come more understanding for our brave veterans, emergency workers, and other survivors of traumatic events.